Ooh. Hello, everyone.
Hello.
Hey, Tina.
Nice to meet you all.
All right, we're officially live. I'm sending you the link right now in the chat. And I'm also just going to put it in the Slack in case anyone else wants to join. Okay, fantastic. So I'm just going to switch over for a few seconds to some slides just to welcome anyone that hasn't been part of this since the beginning and just give a brief overview of what's currently happening. And so I'll do that right now. Start share. There we go. All right, and I'll just put it in full screen. Okay, fantastic. So I'm just going to switch over for a few seconds. Can you see my presentation deck?
It's loading.
Okay. Brief overview of what's currently happening. So I'll do that. Okay, great. I'm just trying to. There we go. Could I just ask that you mute yourselves if you're not currently talking, just because I can hear an echo. All right, so welcome everyone. And for those of you who are joining these presentations, just to give a bit of context, we are currently running a series of global hackathons to address some of the challenges caused by the current COVID-19 crisis and pandemic. And so we've had the great pleasure over the last week in working with some brilliant organizing teams from around the world in setting up hacks which are happening in 6 time zones that I'll show you in a few seconds. And of course, each of these hacks is happening over 2 days. It's really collaborative happenings, let's say, and online programs where the Unleash community, which is coming from all around the world, is getting together to put their heads, minds, and hearts to come up with some ideas of how we can address some of the big challenges that we're facing. And so just to show you in terms of the spread, so we've got hacks happening in 6 main time zones. And this is the presentations of day 1 of the time zone in GMT+5. And that means that all of these hacks are currently ongoing. We had the presentations from GMT+8 3 hours ago that started. And this will be also going on, of course, throughout the day for all the time zones. And then tomorrow night, when we'll have the final solutions to see what teams have managed to come up with and prototype throughout the weekend. In terms of results, in terms of amount of participants and some numbers, so we've had over 240 participants joining us for this hack from 73 countries. And what we're seeing, it's just quite amazing, is that of course we have people that are joining from countries where the stages of the development or spread of the virus is different. And therefore there's lots of ways of learning also from each other and also understanding how others are dealing with the current pandemic. We have more than 100 facilitators and experts that are joining also from around the world to really work with the teams throughout the whole innovation process and really help them frame the problems in the right way, come up with some great ideas and move along this innovation process in the best possible way. So big thanks to them as well. And lastly, we've had a really gracious partnership from Miro, which is a collaborative tool and dashboard. And they've essentially provided all the licenses for this hack for free so that we are able to collaborate and actually come up with these solutions. Just a brief overview of how these hacks are organized. As I mentioned, there's an organizing team that is running this hack for GMT+5, and it's the same for each of the different time zones. And they've really been amazing in pulling this all together, working on no long hours and working really hard in making sure that this whole online event can be taking place in a smooth and really effective way. So yeah, I think we all owe them a big thumbs up and a big thank you. And so definitely on my side, huge appreciation of that. We have teams of 3 to 5 talents that are getting together to see how they can address some challenges. As I mentioned, facilitators that are supporting them, communities that are getting involved as much as possible, so understanding from people who are facing these challenges how they can be helped and what really are the problems that they are facing. And finally, we have a range of experts that are coming in from different technical backgrounds to provide some more depth into the challenges we're looking at. And lastly, just to give a brief context of where this presentation sits. So we've spent this first day looking at how to frame problems related to COVID-19 and starting to come up with some ideas, and then briefly sketching out what these could be. Of course, different teams will be at different stages. So teams might be presenting more on the problem front, and others might be looking at ideas already, which is absolutely normal. And then tomorrow, we'll have at the same time a presentation where the teams will show how far they've gone in terms of an actual initial prototype. There's just someone mentioning something in the chat. Okay, well, I'm now going to just pass it over to the organizing team, who are also going to present the rest of the session, and I'd also love them all to introduce themselves so everyone can get to know the great people who are making sure this can happen.
Thank you, Greg, and great introduction. Hey everyone, I'm Sadir Isa from Jordan. I was in Unleash 2019 in the health and well-being track. I'm currently the head of innovation in an organization in Jordan that supports youth, and we work diligently with the SDGs and UNDP in the MENA region. So I'm really happy to meet you. I will let my teammates introduce themselves as well. We have all the presentations that you have seen from our side were done by Martina, so she can start with presenting herself.
Perfect. Thank you, Sadia. Hi, everyone. My name is Martina Coleman. I'm from Buenos Aires, Argentina, but I've been living in London for the past almost 2 years. My expertise is in chemical engineering, climate change, and sustainability. And I'm currently working for a tech startup here in London. It's a social enterprise that is trying to prompt the reduction of carbon emissions for individuals and small businesses through behavior change. And thank you so much for participating on this hackathon. And we really appreciate all your efforts, and good luck with the presentations.
Awesome, thank you, Martina. Next, our two technical guys. So I'll start with Eunice. He was teleporting everyone to their breakout rooms. So shout out to Eunice, go ahead. Your mic is off.
Okay, that's I'm a technical guy, but I forgot to switch on my mic, so it's not a good start. Hey, so my name is Eunice. I'm from Morocco, but I'm currently living in Turkey. It's been a year now, and before that I used to live in Malaysia for about 8 years. And currently I'm doing my master in mechatronics. It's a byword for electronics plus mechanical engineering. And I'm also starting my own entrepreneurship here, a company called Yonedal that I'm planning on opening very, very soon. And it will be working on energy harvesting, something related to electronics. And it's my first time having a hackathon online. I have attended many hackathons like physically in brick and mortar hackathons, but this is the first one online. And I hope this situation can be alleviated very soon about the COVID-19. And I wish good luck to everyone. Thank you very much.
Thank you, Eunice. I'll go next to He. You can start.
Hey, this is He from China. And literally, I mean, GMT+8, I'm going to have dinner here. Yeah, I'm earliest here. So I'm the other technical guy of this team, and currently I'm working on a startup named Nidal that is crowdfunding social innovation. And I'm working with foundation in China to support those coronavirus-related social innovation to go further after hackathon. So 1 month ago, I was in a hackathon, and our team is one of the finalists, and now I have the chance to be the organizer as well. So being on the two sides of hackathon, gave me great insight of this global collaboration. So I'm really grateful to have such a chance to work with you guys. I hope all your projects can go further. I'll be there to support you post the hackathon. Thank you.
Thank you. And we have Sudbi doing all our media posts and all of these great things. You can go ahead.
Hi everyone, I'm from India. I was an Unleashed talent in 2019 for the SDG 4 track. I'm a design educator at Srishti Institute of Art Design and Technology, and I've also co-founded my organization which does design-led innovation-based work. It's called the Epicenter, and I'm very interested in design, learning how SDGs can be interconnected through a systems and a design-based approach, and how emergent forms of leadership can develop from across the globe, across different sections. I had been selected as a facilitator, but I wanted to be a part of an organizing team because what I'm really interested in at this moment is to understand different contexts of the problem, understand it locally, globally, and individually, and see how we can frame the problems through its many layers so that in order to jump into problem solving, we don't create more problems. So all the best to all of you. And hopefully I'll be able to share many more stories and perspectives about COVID-19 through this process, and also interested in giving my mentorship to different solutions and solution giving teams in future. Thank you.
Thank you, Sudbi. And we have also Zana. Finally, we have him. He is also running our press release and working with other organizations to make this as public as possible and to have all this publicity. So Zana, you can introduce yourself.
Hello, good guys. You are doing a good job, absolutely. My name is Zana Samaila. I'm from Nigeria. I was the Unleashed talent for 2019.
We can't hear you so well, Zana. Can you get closer to the microphone?
Okay, let me. So right now, are you hearing me?
Yeah, much better.
Thank you. So my name is Zana Samaila, and I came from Nigeria. I work in the education sector. I was part of the Unleashed track for SDG 4 in 2019 in Shenzhen. And I was the co-founder and communication lead for Spotlight for Transparency and Accountability, where we primarily work on the education sector, whereby we are tracking government project all across the Yobe state in Nigeria, particularly in the northeastern part of the country, where we are demanding for accountability, improve service delivery, and promote democratic governance. I was also a member of the Commonwealth Youth Human Rights and Democracy Network, whereby we are an affiliated body of the Commonwealth Secretariat, whereby we are more of issues of concerning the human rights issues. And it was a good idea that I come through all of you from different backgrounds, more especially my team, whereby one came from Jordan, from India, and then Eunice from Turkey. And then we have the great Marcina in the UK, who was based in UK, but of Argentina roots. It was great to connect with all of you. I have an amazing all day. To be precise, I enjoy hearing all of you, your motivation to work for this pandemic that has ravaged the world. And it was good to connect with all of you guys. Thank you very much for having me your time.
Thank you, Zana. So I'm gonna start with how are you guys feeling? Do you feel like you're a bit stiff? You have been like sitting around for like 8 hours almost. So I want everyone to, like, if possible, to stand up, do some stretches, like move around, like don't feel any stress. You're gonna present now, so I want you to be relaxed and comfortable. Awesome. So I'm gonna say hello to all the experts we have here who were with us in the first day and who are gonna be with us in the second day. What's gonna happen right now is we're gonna go team by team from number 1 until number 8. We actually had 8 teams, but due to some technical difficulties in Zoom, they were reduced to 6. So there are 6 teams right now. So we'll go by number. and each team has 3 minutes to present. You will share your screens and you can start presenting. Eunice will keep track of the time and tell you if you exceed the time. And then we will open the space for questions and our experts and facilitators to give you some insight. But before that, I want also our lovely facilitators to tell you how was their insight on the teams and what we're looking forward to tomorrow. So I'll start with our lead facilitator, Megana.
Hey, thanks. Thanks. I think the organization team kind of did a fantastic job because I was almost reminded of the in-person experience through the day. It was, I think, great validation of the community we have built to some excellent shared values. So thank you guys. I think you guys were amazing. I also want to thank my co-facilitator, Suji, and I'll get her also to share her thoughts, but she was super collaborative and prompt all through the day. So it was just a very seamless effort between both of us. And I think onto the teams, you guys were fantastic. Probably this is the first time, as one of you all mentioned, that you were on a virtual hackathon, but I thought the teams teamed really well. I thought the video function kind of helped us, like at least get some sense of each other and feel comfortable. So that was fantastic. I did see that problem framing continued to be the challenge, which I think is a good thing because we should spend as much time as possible on the problem. And I think we as facilitators may have been hard in some cases, but I'm guessing, at least I thought the problem statements finally we walked out with were far more refined with very good user insights. So super proud of all that has come out of today. I also thought we used the expert network really well, not just the experts we brought in, but I think I saw several of you all trying to reach out to your personal networks and getting experts from our personal networks into Zoom calls, which I thought was really, really good, like really dynamic and experts brought in some very interesting perspectives. So all in all, I think it was a great day. I enjoyed this a lot. Thank you for the opportunity. Suji, you want to go next?
Sure. I had an amazing experience. So this is my first virtual hackathon as well, but the team seemed to use every tool that was given to them. They made the most out of the tools. It was amazing. You should have seen the boards that they had. It was great. So teams, irrespective of the size of the team, they just made the most out of it. I love the insights they came up with. I wish we could work on all the insights. It was just amazing. I had an amazing experience. Thank you. Thank you to the organizers and the entire Unleashed team. Anyone else?
Sadir, your mic is off.
Oh, okay. Sorry, my mic was off and I was talking. So thank you, everyone. And thank you, my lovely team, facilitators, and for the participants to actually commit and stay for the whole time. That was wonderful today. And I guess now we can start with the presentations. So is team number 1 ready? If you're there, say yes.
Yes.
Perfect. So now you can share your screen and introduce your teammates and start presenting.
And I will start the chronometer for 3 minutes.
Is my team here?
Yeah, hi, this is Preeti.
Great.
Is everything okay?
Yeah, sorry. Preeta Raj, are you going to present?
I'm present. Hi.
Okay.
Yep.
Can you see my screen?
Yes, we can see it.
Preeta, you can start.
Hi everyone, this is Preetha Chakraborty. I am from Kolkata, and by profession I'm a filmmaker, and I've attended Unleash 2019 in Storyteller track. It was a great experience, and I'm really glad to be back again. In these trying times, this something gives us all of us hope to do something to be productive. Thank you so much.
Preetha?
Yeah.
You can go. Hello.
Yeah, you can start.
Yeah, Preetha, you can start. Yeah. Can you hear me?
Yes,
Yes,
yes.
we can hear you. Okay. There's some connection problem. Yep. It's okay. I'll just start with a problem statement. What we have thought is young professionals in South Asian countries who are staying home because of lockdowns due to COVID-19 need to better manage stress to cope with the new norm. Because even though they want to keep their anxiety levels and productivity levels in check, the constant need and bombardment of coronavirus related news in all media is preventing this. So this is our problem statement. Can we go to the next slide, please? So what we have thought of an web portal where we will have different sections, and this will be reaching out to the users we have mentioned. And there we'll be giving services like, talk with expert, where individual and group therapy to start users off and on their journey. So they can directly connect with an expert and talk to them. And what we want for the web portal to give everyone a very customized and personalized support, because at this more trying times what we all of us we need is kind of very individualistic and personalized support for all of us, because a generalized way might not motivate us enough to go and use those kind of solutions. So we'll start with this talk with an expert thing, and then we'll also have 7-day self-healing program where we'll also give option like yoga, meditation, pranic healing, or people for whom this kind of things doesn't work, they can also opt for light exercise set and things like that. So we'll have different options like that. And another thing we also feel is during this situation, one of the main problem is all of us have kind of derailed from the regular routine we used to have in our life. So again, with the support from the expert, like individual can recreate their routine, and they can recreate a customized routine for themselves, which is more like home based, because if they don't have option to go out to gym, an expert can also support them and motivate them to start doing the similar things and find out solutions within home, like sport exercises, sport jumping and stuff like that, which you can actually do in your home. So it's more about supporting and motivating people to kind of not exactly replace, but kind of creating a new kind of model for themselves. And the fourth thing will be the positive, building more of a positivity at this green time. And so we'll be building up more positive news around the world, and they can also have individual like daily gratitude check and articles on positivity and stuff. Raj, you can continue.
Yeah. 2 minutes.
Thank you.
Yes, absolutely. So the idea is to redefine this narrative in a way that rather than hearing the news of what the corona is doing to us, we create the narrative in a way that helps you with the optimism so much that it is fixed through this portal in your daily routine. So these packages, as Pritha rightly mentioned, would be complementary to every user for the time of the pandemic. And once it ends, we'll be probably able to shift to more of a social entrepreneurial model. Yeah, thank you.
Thank you, guys. Great presentation. We will now leave some time for our facilitators and experts if they have any questions. So probably about 3 minutes as well. So if anyone has any questions, please go ahead.
Hello, everyone. I actually do have a question. I'm sure we've all been reading a lot. This is a great initiative, and I'm sure mental health is extremely important at this point of time of the lockdown. It would be great at this point of time to actually show how does a mental health affect immunity of human beings as well. I know that this is embedded in your solution and embedded in the thoughts that you've been giving out, but it's also, there's a lot of research that's previously been done on different kinds of diseases and illnesses, whether it's virus related or not, that it's very important to keep up the positivity within human beings to actually be able to enhance your immunity system. It would be great to actually mention this at the beginning or at some point in the early stages to actually give a boost to this great initiative that you're working on. And I hope you guys have such research available for you.
Yeah, of course. Thank you. Thank you. Those are some wonderful inputs. As you rightly mentioned, the same is being embedded in the solution. So we'll surely give the fundamentals more time and we'll work upon. Thank you so much. Wonderful.
Hey, Meghna here. I think as you start to build upon this further and you think about your channels through which you can reach the maximum number of people, you should look at organizations as a means to get to these professionals, because organizations today are looking for solutions, which they could very easily roll out to their people. So that's something to consider.
So so if I'm understanding this correctly, sort of a B2B model at first, so that we can reach the end customers.
Yeah, because yes. It'll be easier for you to do a B2B versus B2C because it'll be that much more difficult.
Right. Thank you.
I think I also, this is Shudevi. I also had a few questions suggestions. As you can see, the modality of this and even the content of this definitely makes a certain section of people in the society your target audience, right? It can't go beyond that, which is absolutely fine. But I would think, I mean, in different places, even in India, that there are many people who might be staying in the same house, and something like this might be very personal, how that can sort of work out. And will someone be comfortable in the presence of another to talk about these things? And the other challenge that you might have to face is if people say that many of these things are already available in different portals and different modalities. It might not be called a pandemic healing project, but how will this be different, and what specific thing about COVID-19 is it that you're sort of addressing through this particular portal? Why would someone come to this over so many other things where healing and other kinds of positive news and all these kinds of things are taken care of?
Okay, so to answer this question, so basically when we're talking about the 7-day self-healing program, to say, or the entire program as a whole, so we're going to create an entirely catered content for COVID-19. So when we're talking about yoga, meditation, or pranic healing, or light exercises, or even the individual or group therapy, everything is around COVID-19. Specific customized videos are going to be made, customized instructional audios are going to be made.
Yeah.
Even the routine creation with expert, this is like a completely new thing just for COVID-19. So you're getting the entire healing, you can say, in one center.
Yeah.
So that's
So,
how
yeah,
we are differentiating it.
my question in that case would be, then is it, if it's centered around COVID-19 based healing, what kind of profile of people are you particularly going to be looking for?
Young professional. We are focusing on young professional. Yeah. Young professional in South Asian countries. So yeah.
I would
Looking more
also
reachable.
add, I would also add another thing that, you know, for this particular web portal, as we have kept like reaching out to an expert through phone or online, that is the first thing which is going to happen. So that is something you generally, you know, is not available, like, you know, where you can directly speak with them, like your first, and just, you know, talk to them for your immediate need. And at this moment, I think more than generalized informations which are available in like in internet, I think that is not working anymore, because many people, they need actually customized and individualistic approach towards you know, addressing this whole thing. So we'll keep that as our priority in the web portal.
Yeah, it's
Thank
more
you
generalized
so
out
much,
there.
guys.
Yeah.
I'm sorry to cut you off, but because we exceeded the time by a mile. So maybe after the session, if there are still any speculations or questions, we can be happy to help you out and answer them. But we will be moving on to the second team right now. And thank you so much, guys. Give them a quick round of applause for appreciation.
Thank you all.
Thank you. So is the second team here?
Hi, yes.
Perfect. Yeah. So you can start and share your screen.
All right. Is it visible?
Yes, we can see it.
Yeah, I think you can see everything that's on the screen. So we did not have time to prepare a presentation, so we just used the board itself. Excuse me if some funny messages pop up while I'm giving the presentation. It's 4 of us, 3 from Nepal and 1 from India. So the problem that we identified was urban poor who use shared spaces in urban areas need to maintain proper hygiene conditions under lockdown, because shared living conditions put them at risk of contracting the virus than the rest of the population. So basically what we're trying to say is a lot of the urban poor population live in shared spaces, shared rented rooms, and also have to share the bathrooms that they use on a daily basis. And according to the trend that we saw in India and in Nepal before the lockdown was supposed to keep people where they are. But the announcement of the lockdown meant that people were getting on cramped buses and heading home back to their villages in order to find that comfort that was lacking in the spaces that they're living at. So we're more focused on the hygiene part of it, on why did these people leave these spaces. And one of the reasons is even if they want to maintain social distancing, practice it, it's not possible in small, cramped and small shared spaces. At the same time, hygiene is a problem because they're sharing bathrooms, there's water scarcity, and maybe they do not have access to hand sanitizers or any of the alternatives that's out there. So what our team came up with is we just called it the magic helping hand. I'm not sure if all of you know, but my dad used to use this back scratcher like a hand and to, you know, scratch his back. So we just thought that maybe something like that could help us, you know, open the toilet doors, you know, switch off or switch on the lights, or anything that a lot of people, or any of the surfaces that a lot of people touch. For example, in the elevator, people can just take out their magic hand and push the button, and, you know, they don't have to use their hands, and it's much easier to sanitize the surface. Um, um, surface. I mean, you can accidentally take your hand to your mouth, or your, you know, to your face, to your eyes, your nose. So we're just trying to limit the contraction, and but contain it, and not let it spread on a wider scale. So how do we make these products? We thought about, oh, you know, 3D printers are there, but then it's going to be expensive, and I'm not sure how many 3D printers there are in Nepal. I don't know about India though. Parth might have a better idea. But while so we were thinking that, you know, there are already producers who are producing back scratchers out there, which means these things are in production. So maybe a little bit of modification, identifying who produces them, who manufactures them, can play a huge role in providing them at the market at a cost that people can afford easily, and use it as an alternative to go around. Because one of the things that we as a team felt was, you know, kind of showing symptoms of OCD, like after coming home, like having to wash your hands over and over again, and skin breakage and stuff like that. So maybe just having something handy like an umbrella, a magic helping hand could, you know, help us. I mean, this could be the next way of, you know, like 50 years down the line, why do people carry an extra hand in their bags? And this could be the reason why they carry it, and just make
Thank
it
you
alive.
so much,
Thank
Team
you.
2.
Promise.
We're done with the time, so thank you so much. We will open now the floor for any questions anyone could have.
I think I have the prototype here. Can you see my video?
Yeah.
Is this what you're talking about?
Yeah. I'm gonna put on my video.
I'm already
as well.
using it now. Your product is already there with me. That one is from Malaysia, so I got it from Malaysia. It's not sold here in Turkey. It's only in
Cool, because
Malaysia.
I have one as well.
Oh, okay. So you mean you can use it for instead of reaching to your face, or that's something that can be used for so to prevent people from touching their faces and
Yeah,
avoid.
I mean, unconsciously, I mean, when over time, you know, we usually tend to touch our face, our, you know, like maybe just rub our eyes or things like that. But if you have something like this, I mean, this could also be probably like if we modify it a little, even while traveling through buses or trains. I mean, this could be something that you can just hook onto and, you know, not fall. And
yes, it's true. It's very handy, as you can see, very handy, very useful.
That's the idea.
Yes, yes. Yeah.
Am I still sharing? Okay.
So do we have any more questions? I think someone here raises their hand. Parash, I think. I don't know if I'm saying it right.
Yeah, it's Praharsh.
Yeah. Praharsh, okay.
So I just had one doubt, like if the instrument, the magic hand, can be really be helpful in using to open or anything. But what if that virus can survive on that stick itself? Then, like, is there any understanding around the same? Or
Definitely. I mean, I think that's something that needs to be figured out. Our team tried to find out like how long does, you know, what could be the best surface for it, or what material could be used, looking at the chances of survival of the virus. And to be honest, we don't we don't have a definite answer to it yet. So if we ever enter a prototyping phase, maybe that could be something that we could look into.
Sure. Thank you.
You can go ahead.
Yeah,
মা
me.
রুমটা ভিড়িয়ে দাও না, এখন আমাদের টিম নাই, অ্যান্সার করতে হতে পারে। মা দরজাটা ভিড়িয়ে দাও, শেষ হলে আমি বের হয়ে যাচ্ছি।
Really, that was my roommate.
Yeah, hello.
I have a question as well.
Yeah, start.
Yeah, I'm just wondering that wouldn't a glove just work as well? You just put on glove and you just put those handles, you know, with the glove, so that wouldn't bother you if you touch your face and cut the virus.
Yeah, I think we're also looking at it at this at the side of, you know, how are we going to manage waste in the longer run. I mean, there are so many products that's going to waste.
A company called Eunice.
Yeah. So, sorry, if I got the question right, you mean like there are already gloves out there, so why do we need something, right? Yeah. And we're also looking at the carbon footprint aspect of it. Like, I mean, how many gloves are you going to use in a day? And, you know, how are you going to reuse it over and over again? And cutting time off of like having to maybe wash it, sanitize it all the time, like the gloves, or maybe using multiple gloves at a time within a day. So just keeping account of it.
So I think you can choose those reusable gloves, right?
Sorry?
You can also use those reusable gloves instead of the single-use glove.
Yeah, but I think that's the part of it, like when you're using gloves, there's still chances of you taking your hands to your mouth or your eyes or maybe your nose. Because while I'm gardening, I tend to do that, you know, without realizing it. So even while I'm wearing my gloves. So yeah.
All right, great guys. Thank you so much. A round of applause for team 2. And now we'll be moving on to the third team now. Are you guys here, team 3?
Yes.
Awesome. So you can share screens and start.
Kamalpreet. Hi, Sudhir. Kamalpreet here. Let me just share my screen. Just let me know when you know when you can see this.
We can see it.
Cool. So let me first introduce my team. I'm Kamalpreet from Delhi. I have Rahul Jain on my team, who's from Mumbai, and Renita from Bangladesh. So we three wanted to work on this problem. So just wanted to share one small story before I begin the presentation. So the story is of Anil, who is a 27-year-old adult who works in the auto sector, and he has been working pretty hard in the sector and has been really doing pretty well. But owing to the losses that the auto sector has been experiencing from past 1 or 2 months, and the International Monetary Fund coming and announcing today that we could see a slowdown in the economy, which could be worse than 2008. So he has been having a bad word with his boss that he might lose his job, and he's already going through certain pay cuts. So we wanted to come and solve his problem, and we wanted to come and make sure that people like him survive the economic downturn. So we wanted to create a solution for these people. So our users are people like Anil, who who know that there are a lot of companies, tech companies out there who are coming up with a lot of free certification programs, which can be consumed by a lot of people. But people like Anil, they are still unsure of that which certification to pick up on, and from there where to move ahead. So we suggest that we can create a app which we call it as Learn It, which is a machine learning hot market skill so that they stay relevant. So if he comes in and keys in certain his key skills, the app can recommend that he can move to various roles in the tech industry, pivoting on his core sales skill. So he can get into AI sales kind of a work. He could get into cloud sales. He could be a product manager. And the app helps him reach out to the already existing courses out there, which he can use and upskill and cross-skill himself, and learns from his feedback, and also learns from the various inputs that the recommender system gets by web crawling. So this is a typical layout of how the app looks like. So it takes in all his existing skill, what is his current job, what industry he works in, and what are his key skills, such as negotiation, because he's a sales professional, and then gives him certain learning paths so that he can get into AI sales, he could get into cloud sales, he can be a product manager. So if he clicks on any of these 3 or 4 learning paths, he can just quickly dive into those free and freely available courseware on various massive online open coursewares, and quickly have a flavor of that, whether that is catching his interest. And then and he can give the feedback to the app whether this course really matches what he was looking for. And getting this feedback loop quickly closed, and making sure that we are giving more and more right learning paths. We are recommending more and more right learning paths to various people from various industries who are looking towards pivoting their career in the right direction, so that they stay relevant in this economic downturn which is predicted. So this app can be really helpful. So how we plan to do this is we plan to partner with already existing major MOOCs that are out there, and make sure that the app understands the current skills of the user, recommends the alternative career paths that can be taken by him in case of if his own sector is going through an economic downturn, and make sure that he uses his time when of lockdown, and he upskills and cross-skills himself accordingly. And the recommender system works on a machine learning algorithm which keeps on improving itself, and the more people use the system, it will start giving better recommendations every time. So the innovation that we want to talk about.
Team 3. I'm sorry, but because we're also past the time, like this is minute 6. So if you have something, can you quickly just wrap it up?
Yeah, so just I want to quickly wrap up on the innovation. So we are not trying to create anything massively new. We are already going over the already existing massive open online courses which have been made free by various digital providers out there. And what we want to do is quickly create this machine learning algorithm, which my team has the capability to, because Rahul on my team is a data scientist and can quickly come up with this kind of machine learning algorithm, and which will start working pretty quickly, which is the need of the hour. And the impact that we are talking about is some 2 million young adults across South Asia within first year, because the rampant downstream impact of this of the COVID would be it will go on pretty long, right? So people need to keep themselves skilled up so that they stay relevant in the job market. So I think that's
Thank
all
you
from
so
my side.
much, Team 3. Okay, so that's a fantastic presentation, and sorry for like the short timing this time, but tomorrow you will get a better chance to actually present and to prepare for the time. So thank you so much. Since we're also down a bit on time, I will take only one question regarding your idea. So if anyone has a question, please go ahead.
Yeah, I have a question here.
All right, go ahead.
Yeah, let's say this is not totally like completely new. So what if those Mac software like Coursera, like MOOC, they just develop their own learning path, for their users? What if that happens? What if
So currently, yes. So currently, most of these massive open online courses, they are not giving them the learning paths. What they usually give is that you pick up an area, like for example, machine learning or artificial intelligence or something like that. So they are not really assessing them on what are their existing key skills and then build upon or and gives them the recommendations on that how can they use their existing skills and then pivot their career into the skills that are there in the market to stay relevant.
Also, the coursework that you find online are not free of cost. We are essentially taking all the free of cost MOOCs and open courseware that are available online, and all of those things will be taken into consideration, not just the paid ones.
Thank you.
That's right.
Thank you, Team 3, and a round of applause for Team 3. Thank you so much.
Thanks, Sudhir.
Yep, and if you could just unshare your screen, yeah. So, all right, perfect. So now we have 3 more teams left. So we will go, Team 4 and 6 are not present. So we will go with Team 5 right now. Is Team 5 here?
Yes. Yeah.
Perfect. So you can start and share your screen.
Can you see our screen?
Yes, we can see it.
All right. So Soumya and I were actually in one team, and it was just both of us. I think this one is actually still work in progress for us in terms of a solution itself. We've actually pulled together a few ideas and concepts where we feel like we'll solve the problem statement we came up with. But tomorrow, I think it's going to be quite a lot of rapid prototyping to actually come up with some sort of user interface for how this solution would look like. The problem statement we came up with was how might we meet a surge in demand for COVID-19 related medical supplies, mainly PPE gear and ventilators, available to use in government hospitals in India during the virus outbreak. And I guess in terms of what we were planning on actually doing is we were looking at an online marketplace to connect government hospitals to PPE gear and ventilators to meet surge in demand. And the various verticals we were focusing on were things like sharing resources. So an ability for hospitals to actually share their inventory between each other. So surge periods between government hospitals can be achieved with the availability of the right gear at the right time. Looking at actually engaging the community, connecting self-help groups, other groups to distribute the PPE products to non-hospital staff, e.g. police. Looking at local innovation and actually connecting with local innovation efforts in creating reusable PPE gear. And this is something which is actually already being used in India at the moment, but just looking at how do we bring those resources and connecting them to an online portal. And all of this kind of underpins with two key things. First one being supply certainty. So at a point where you have a pandemic at this scale, you want to make sure that you're not only leveraging your local supply chain, but also an international supply chain. So actually building an international directory for all suppliers for PPE and ventilators with the real-time supply ability. What that really means is not just the government saying that, hey, we need 100,000 masks, but actually having suppliers who could say, we can provide you guys with 100,000 masks by April, end of April or something like that. So actually just really getting that certainty, and that could be pooled with a number of suppliers who could do that. and also looking at effective localized distribution. So that actually really underpins most of these verticals. So thinking about, how the supply chain itself can be broadened locally, but also making sure they store the equipment and distribute it in a timely manner. And that's all, again, looking back at the sharing of the resources where there is a bit of an inventory asset management. So this local distribution would actually make sure that, the equipment's actually been passed on to the right hospitals. Soumya, is there anything you want to add?
So like Claudian had mentioned, we have these concepts that we've come up with, and currently we are looking at, while we're trying to narrow it down to, like specific ideas, to take it further into a solution phase. We're looking at both effective localized distribution as well as, like local innovation, because we feel that they might actually pull up together to actually add on, have an additive effect on the hospitals and the number of protective gears that are available for, the healthcare workers themselves.
Perfect. Thank you so much. That was a great presentation. Thank you, guys. And now we will open the floor for a couple of questions. So whoever have a question, go ahead. Yeah, sure. Go ahead, Serene.
Hi guys, this is a great idea as well. All of them were great ideas, especially when we're talking about supply chain management. This is a thing that's going in all industries, not only the healthcare. It's an issue everywhere, even with the food industry and so on. I'm a bit curious about your B2B sort of engagement. Is there any sort of transactions that are going on, and how are you going to handle this? My other comment is going to be for the local innovation. I think this is amazing because a lot of people have the resources, they just don't know how to do it, especially when we're talking about ventilators and how can you do 3D printing for them and so on. We've been hearing a lot of people are doing that, but nothing that's been out there. And if this is going to be an open source for other countries to use as well.
Yeah, so that's definitely something we were looking at. I guess in terms of actually us picking India was, during the problem statement, we were told to actually really make it niche and really think about being specific. So for us, I think India was just probably a test market. We would envisage something like this to be worked in a developed and also developing country. Because when you really think about it, you're opening up a whole portal and not just getting countries to kind of defend for themselves, but actually opening it up to the wider market. And having an online marketplace would actually enable that to happen. In terms of local innovation, and especially around 3D printing and things like that, I'm not sure about the market space within that in India at the moment, but I know in Europe, there's actually quite a lot of companies who are already doing that. And those are the conversations we've already had with the expert around, how do we procure for India, for example, around those reusable PPE gear, where they can sterilize after using it, so they can actually reuse it for later on. So in terms of actually that, there's already a lot of companies who do that. It's actually bringing those in and actually connecting the dots with the right hospitals or the administration who would procure these. Funny enough, though, we do actually this one more we came up with. We do actually have the source code for it. I think tomorrow it's going to be quite a important day for us to actually really nut out which areas we'd like to focus on and actually do some journey mapping and looking at some user experiences for the interface itself. But the back-end work of this is actually already done, meaning that you have to tweak it, but it can be manipulated to make it a quick turnaround.
Amazing. Thank you so much. That was a great presentation, guys. Thank you so much for the information. Let's give them a round of applause. And now we will be moving on to team number 7.
Hello, hi.
Before that, I think Ms. Serene also has something to say, so please go ahead.
I don't think so. I think it could have been from earlier time.
Okay, perfect. All right, sure. So yeah, Team 7.
Sure, I am sharing the deck. Just let me know if it's visible to you all.
It is visible.
Okay.
Perfect. Great. Then I can begin. So I think we wanted to basically emphasize on how the informal sector's contribution to the GDP and in terms of number of people involved is so massive. And we talk about availability of supply for them during the COVID crisis, but we often do not think of the lack of linkages that is actually needed to execute this supply and ensuring that this reaches out to the informal sector population. When we talk about the informal sector, we're talking about both farm and non-farm. So right from farmers to construction laborers, to rag pickers, to beggars, to domestic help. And that's why we thought that we need to form a cluster-based approach. So our basic problem that we devised because of this insight was that we basically wanted to only focus on one slum as a pilot. Families in Basti, Hazrat Nizamuddin, in the informal and unorganized sector do not have the sources of income right now and need supply of necessities such as basic food and hygiene as committed already by the state and central governments, because there's already a last mile connectivity gap and broken linkages that exist, because of which we feel that there's like the unanticipated nationwide lockdown, which was also extremely necessary, is currently causing a great level of socioeconomic and health related shocks for the vulnerable groups. So we thought about it and we wanted to further frame into how can we problem solve this. So we are the link. We are a group of 3 members. We have a policy researcher, Praharsh. We have a business developer, Prakriti, and I'm a development practitioner, Kanika. And what we want to do is we basically want to bridge the gap and ensure that the execution currently takes place normally. So our solution is basically stemming from a normal rationale that we think that COVID related execution of policies is very simple for the formal sector because they have systems laid out, but it excludes the informal sector completely. Our theory of change is that if we are able to provide doorstep deliveries of basic necessities, then we will be able to lessen the impact of the detrimental impact that the global pandemic can have. We have a two-way solution which recognizes the constraints of mobility, finance, and execution. Our service delivery mechanism basically calls out for a declaration of compensatory the link assortment of food and hygiene package by the authorities. We want to ensure that the private sector and the urban citizens who have the economic bandwidth fund it, and we think that we already have the public sector in like from India already having the raw materials. So all we need to do is be the link there. In terms of our delivery mechanism, we want to ensure that we run a van where we can where we can also create awareness of the COVID situation and at the same time provide the packages for food and hygiene. Our design protocols will be 4-way, where we're ensuring that sourcing, packaging, transport, and delivery are following WHO guidelines of sanitization and hygiene. Our scope right now is only at one slum because we're following a cluster-based approach, but we want to eventually scale it up to other geographies and even scale out the assortment packages to include other goods and services. It could be liquid cash, awareness pamphlets, etc. Our timeline right now is to hopefully start by mid-April because we recognize the urgency of the situation, collaborate with as many partners to ensure that by April end, we can wrap up at least the pilot. And by May, we roll it out to other slums and eventually actually be able to roll it out the package to other areas in North India and further in developing countries. We are the link and we hope that you can come be the link with us.
Thank you so much. That was a brilliant presentation. So now we will take about 2 questions. So anyone who have questions, please go ahead.
So I just wonder what will happen to your solution after this pandemic. Will that also be useful after the pandemic or only be useful during the pandemic?
For sure. I think one thing that we haven't, one thing which public health professionals keep repeating often is that the virus strains of any virus will keep repeating. So I think this would be a solution that disaster management institutions from various developing countries can actually adapt to and take it up as a best practice for ensuring that at least in such unprecedented times, last mile delivery is made possible, and not only direct benefit transfers, which is mostly what governments do, send out the money to banks, but they often do not realize that the people are restricted by mobility aspects and cannot actually access the banks at such time. And several people in the informal, unorganized sector are not even as tech savvy to be able to use it. So I think it would be highly relevant for any public health disaster to be met by developing countries.
Sure, thank you. And also, will it be a non-profit or for-profit company in future?
Praharsh, probably you could answer
Sure,
that.
sure. As of now, the main product of the link is to design a mechanism that can actually work around. So currently we are trying out as a pilot for non-profit, but certainly once the pilot results are out, it can be bring in as a for-profit company as well. But the major stakeholder for us is the government, and we are not sure how the government can take it up, whether they are interested in employing any for-profit company in this sector. But there are certainly a philanthropist who may like to sponsor this kind of projects.
Thank you. Thank you for the good work.
Fantastic, guys. Thank you so much. A round of applause for Team 7. Thank you all. And now we will be moving to Team 8, but also we have someone who is going to present as a team by his own. He was a special case, so we will also have him present. So Team 8, please, you have the floor. You can start.
Thank you very much.
Is everyone present from Team 8?
Yes.
Yes.
So who's sharing the screen? Imad, maybe you can start sharing your screen. Yeah.
Yeah, just let me know when you can see it.
Great, we can see it.
Is it clear?
Yes, yes, we can see it.
Yeah, it's just loading.
Ready?
Yeah.
Okay,
go
let's
ahead.
start.
Hi guys, we are COVID hunters. To start with, I'll share the user profiles. Mr. Fahad Ali is a male, 38 years old from Pakistan, who is a banker and lives with his kids and elderly parents. Despite of the lockdowns, he has to go to the bank for work and he needs the best routes to be safe. And secondly, we have Ms. Sadia Khan, who is a garment worker from Bangladesh. She is showing some symptoms of COVID-19. And she's not aware of the location where she can get the testing facilities and hospitals, which is treating the COVID-19 patients. So for her to route to the best possible hospital and the closest location for getting the testing facilities, she also needs the best possible route to make the best decisions.
We've come to realize that people, and especially in developing countries and settings, they have a high vulnerability to infection as they don't have access to accurate information that is needed to make informed decisions, especially about the necessary movements. And as such, our solution is the following.
I'll briefly summarize our solution and highlight the key features. So COVID Movement Map is a responsive website portal that displays a map which can be integrated with Google GIS, providing near real-time updates on the number and location of currently affected COVID-19 patients, including individuals in home quarantine or in government quarantine centers. As shown in the map here, the solution will highlight the risk zones categorized as high, medium, low, allowing the users to identify which areas to avoid. It will also provide users with push notifications and warnings if they are within a certain range of a confirmed patient or moving into a high risk zone. We will also show key statistics on COVID-19, such as the number of confirmed cases, number of deaths, recovered cases, etc. In the next slide, we're showing another feature of our solution that would display the nearest hospitals, pharmacies, supermarkets, or test centers from a user and provide users with information about their opening hours, availability of doctors, and patient appointments. It will also allow users with visibility to near real-time inventory stocks of masks, hand sanitizers, and other essentials from supermarkets to minimize their movements. In unavoidable circumstances, when a user has to travel from point A to point B, they can benefit from our solution by taking the safest route based on risk zones that is suggested by the map. Over to you, Zimran.
All our team members feel this is a winning concept. We are providing enormous value to our users, from trustworthiness to accurate information, all offered in an easy and visually appealing way. We are minimizing the risk of infection among citizens and improving their decision-making for essential movement during isolation period. We are also making impact across a wide range of SDGs and contributing directly to the reduction of panic buying, increase in social distancing, and the containment and prevention of the spread of COVID-19 virus. Thank you. We're open to questions now.
Thank you so much. Great effort. Yeah, anyone who has a question can go ahead. Yeah, of course, go, Ms. Serene.
Hi guys, I just have a question about who updates the data. I might have missed this part of it. So is the data updated by government, or is it everyone updates their own data saying I'm in this position, or is it the GIS based on I understand in terms of location, but I don't understand in terms of who has the disease or who has the COVID-19, and how do I update it and it goes onto the map itself?
I can take this one.
Okay, Zimran.
Yeah, then maybe Imad can follow up. So basically we have
two
sources of data. Two types of data. One is about, the affected patients, what are the quarantine facilities, which zones have been locked down, which zones have been marked high risk, and like how many people are quarantined, home quarantined, institutionally quarantined. These information we have to do a partnership with the government or a development agency, preferably like ADB or USAID. They're going to partner with us, and we're going to partner with the Director General of Health Services within the government, who are currently monitoring and recording the data. But their main obstacle is they cannot convey the information in a much more easily approachable, visually appealing way to make a proper impact among the people to change their social behavioral ways. So that's one part of data. The other source of the data is crowdsourcing information. Like, for example, monitoring the number of doctors available in a particular area, or doctors providing services, type of services in a particular zone. So these are going to be, the platform is going to be made open to the doctors who are going to mark them, mark their operational activities in the map. And this has been incorporated in discussion with Dr. Ram, with one of our experts, who gave us this, this idea that most of the doctors would be happy to, put up this information on a seamless integrated platform. Imad, do you want to add anything to this?
Yeah, sure. So just to add to that, sometimes if we're working with data sources from other sources, there is a bit of latency in that. So if we allow crowdsource input, then we can promise the near real-time values or around our data.
Hey, teammate. Yeah, I just want you to know that I just invited the other person who is also part of this hackathon. His name is Schumann, to your team, but unfortunately your team has enough members this afternoon. So that team is already doing a similar solution, but they actually collected the crowdsourcing data from those potentially confirmed cases. So I think there is a potential you guys can collaborate, because you are in need of the crowdsourcing data, and they are developing a machine learning model to and also collect those crowdsourcing data. I think there is potential. Thank you.
Awesome. Well, I mean, obviously, we've mentioned that we have the forecasted impact as number 17 for SDGs partnerships and goals for the goals. So definitely, that would be a start for us.
Yeah, sure. We will invite him to your team tomorrow. After we break out the Zoom into different small rooms, and we will put you in touch.
Awesome. Thank you.
That would be great. Thanks.
Any other questions?
Any more questions?
All right, I guess we don't have any more questions. Great job, guys. A round of applause to you. And
thanks very much.
Yep,
Thank
wonderful presentation. So as He mentioned, Truman was supposed to be here today to present, but I cannot see his name anywhere. So I don't think that he got the link to the call. So probably tomorrow he will be joining us. And I want to leave the floor for Dr. Ram to give some insight. He asked me to give some insight after the session. So I'll give him a few minutes to actually give all the participants some insight and help them further for tomorrow. Is Dr. Ram here? Yes, he is.
Yes. Yeah. Hi. Thank you, Sadir. Thanks for having me here. It's great that all of you guys came up with really wonderful ideas. So I'll just walk through all the teams in what way, whether I can help. So the team one was working on the psychiatry mental health aspect, and I think they are looking for experts in the field. So maybe I can connect some of the psychiatrists in my hospital, and we have psychiatrists from NIMHANS who are working in Manipal itself. So maybe they can guide you in your problem statement and solution. So in case if you guys need any help with that, please reach out to me. And moving to the second team, I think their problem statement was wonderful because a lot of people stay in the common places, and be it medics or paramedics or in the community also, even in the hospitals, majority of the doctors stay in a common place. So what I would suggest to them is try to focus more from the problem statement aspect rather than on the solution. Yes, the magic hand is one of the solutions, but please also focus more on the problem statement aspect. And team three, they're working on the technology and during the crisis and post-crisis employment management. I think they're doing a good job. So the advantage that team has is they can leverage with the existing companies who can actually get their idea walk into the marketplace. And team five, again, they're looking for local innovation that can happen in terms of personal protective equipment. Only thing that I want to suggest to them is look into the efficacy of these innovations, because it is very, very difficult for the personal protective equipment to get infiltrated into the healthcare practice unless they are efficient to prevent the virus. And then team five, the supply chain, the van model, I think that's a great idea. Even if some of the places, even if the government is not coming forward, I think that's a great idea, which can be at least implemented in few of the places. So please go ahead with that idea. And team 8, they're doing a wonderful job with the mapping. But again, that mapping is already being done by some of the government officials. What I would suggest to them is if they can try to translate that to the particular community in their terms, in their language, in their cultures. So that will infiltrate more into the community. So it's great to be part of this hack. And so I would, before ending, I would just give an idea on how we work as a healthcare teams in this crisis. So we have right now I'm working in a hospital which has about 2,000 bedded hospital, and we do treat patients with COVID. So what we do is we divide into 4 teams, and of these 4 teams, one team will be off. They will be on leave, and team number 2 will screen the patients. Whoever comes to the hospital, we screen the patients, and if they suspect any patient to have COVID, and they will inform the team member 3. So this team member 3 is very crucial, where they do the testing and they monitor the patients, and they follow the isolation protocols and everything. And out of these suspects, if anyone has a positive, turned out positive, then they'll hand over it to the team number 4. So this will run for about some phasic manner, like we will change the teams every 10 days to 2 weeks. So in this chain, we should make sure that doctors also should not get infected. So this is how we are working more or less in majority of the healthcare centers. So I thought that would give you some insight on working on your solutions further. And I have one question for the organizer. So I just want to hear more about how China has combated and came out of this crisis times, and what are the major steps that China has taken, and which he thinks that other countries are still lagging behind. So if
I think
can,
he is not here anymore. He just
Yeah,
left.
I think he
Yeah.
was
okay,
disconnected.
Yes.
that's all right. That's all right. So
He had another meeting. He told us that. Yes.
yeah. So thanks for having me. Thank you, Sadiq.
All right, thank you everyone. For your question, I'll make sure to ask her about it, and tomorrow probably we can have more discussion about it as well. So thank you so much, everyone. I know it's really hard to put a virtual hackathon, and with all the technology, different platforms, everyone going around, and with Zoom breakout rooms. So thank you, everyone. I encourage you all to be also participating tomorrow. I know we said it's more or less optional, but I would love for the teams to be there, and we will have more facilitators and actually more experts that join us tomorrow. So make use of them. If you want to know who they are, their bios, you can head out to the Miro link and you can see the presentation deck that we prepared. All the information is there. Feel free to reach us at any time. And is anyone of the organizing team having any final comments?
Hi, everyone. I just wanted to thank Sadir as well, because he has been hosting this session and he has also put in an incredible amount of work, like the other team members of the organizing team. And we would really love all of you to be a part of this tomorrow. And even better if you want to continue with this. And I personally wanted to tell any of you in this team, if anyone wants to be more provoked, more nudged, you want to see your ideas and your problems, like, solutions from a different perspective, feel free to reach out to me, because that's something that I love doing. And I probably will be a little more free to, give a little more help in terms of facilitation, just to look at things from different points of view, from different stakeholders' points of view. And I wanted to share a story to end, because we have had a long day. And it's one of my favorite stories, which I keep sharing with my students. Many of you might know the story, but I would like all of us to be remembering the story. They say it's a true story, and you can also find it online on Google. They say maybe in the 1950s or 60s, in Borneo, a lot of people were dying because of malaria. You know, there was an outbreak of malaria, and obviously the World Health Organization had to solve the problem, and they sent people to spray a lot of insecticides and pesticides, because malaria is caused by mosquitoes. And in that process, the mosquitoes did die, of course, but it didn't stop at that. There are other lives which also started dying. One such life that was also affected was a particular kind of gecko lizards. So when the gecko lizard started dying, there was a thatch-eating wasp, which also died in that, which actually increased in number because the lizards were not there to eat those. And because of that, the increase in the number of those wasps, the roofs in Borneo started falling down, which is something which obviously was an unintended consequence. Similarly, there were cats who would eat the lizards, who were also infected or rather poisoned through the insecticide through the lizards, and cats started dying in that process. And you can only imagine what would happen if cats die. The number of rats increased so much that there was plague. So malaria was gone, but plague came in, and that was something that the World Health Organization did not think about. And even today they say that they had to parachute some 20,000 cats into the island. So I think this is a story that a lot of people use in order to talk about why a systemic approach is important when we do problem solving, which is the reason why we need to frame the problem to understand if we're thinking about the problem from one point of view. Yes, we can solve the problem, but what are the other kinds of problems that we might end up generating completely unknowingly and completely unintended? So if any of you would want to think about which malaria, I mean, you are addressing the malaria, which is COVID-19 and a part of that, but in order to reduce malaria, are you bringing in plague? And what can you do in order to sort of eliminate that possibility? If any of you want to have a provocative dialogue, I'm happy to engage in that. Thank you.
Thank you so much, all, and I guess this is the end for today. I don't know if Greg has anything to say or to end the session. I'm not sure if he's actually here with us right now. Oh, he is. Okay.
I am. Yeah, no, I think it's great to hear progress on all fronts and to hear some of the ideas coming up. Really, really positive. Maybe just I think so. I left for a couple of minutes just to get a bite of food. A quick question for you, Sadir. So, are you clear on next steps for tomorrow?
We should all be clear. Yes. We'll work on the gates, the teams will work together as well in the breakout rooms, and the presentations will go as planned.
Fantastic. I mean, the main thing that I just want to say is congratulations to everyone for this first day of hard work. Again, big thank you to the organizing team and the facilitators, and really, really great work, everyone. I'm super excited to see how far we'll get tomorrow.
Thank you.
Awesome.
Thanks a lot. Thanks a lot, Greg.
Thanks, everyone.
See you guys.
Yeah.
Thank you. Bye-bye. Good day,
Bye.
guys.
Bye. See you.
See
Well
you all
organized.
tomorrow.